are going to go live.
Okay.
Hello, everybody. Welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, and today I'm so excited to have a fellow Hashimoto's expert and warrior joining me. We have dietitian Nataliia Sanzo joining us. Hello, Nataliia. It's so great to have you here.
Thank you so much, Dr. Wentz, for having me. I'm such a fan of your work. And, I remember grabbing your book when I was diagnosed with Hashimoto's and thinking to myself, oh my God, this is it. This person knows exactly what I'm going through. As like you said, I'm Hashimoto warrior myself. So to me, you were the first person in my journey. So I think the world of you, and I, just like a million of listeners and viewers, appreciate your input into the world of nutrition, Hashimoto's, medicine. So thank you for having me. It's an honor.
Oh, thank you so much for your kind words. I so appreciate that. And it's an honor and a pleasure to be a part of your healing journey. And so incredible to see you taking your own diagnosis and now helping other people with Hashimoto's as well. So it's an honor when um, I think one frustrated person decides like I just need to speak out and share this with the world, and then that message can reach somebody who helps themselves and then goes on to help so many more other people. So thank you for doing the work that you're doing.
Yes, of course. And honestly, I was never like really interested in thyroid disease in my during my clinical rotations at Vanderbilt University. I did it here in Nashville, Tennessee. And I concentrated like on the community outreach, of course, weight loss. I worked for 4 years at the rehab center at Vanderbilt, doing tube feedings, working with traumatic traumatic brain injury, spinal cord injury, and all that stuff. And I loved it. I loved being there in clinical settings. But then when I was diagnosed with Hashimoto's in 2016, I realized I was in the wrong field. Like, what was I doing? Forcing weight loss on patients that were, bedbound in the hospital, laying there, not wanted to see you. Like, you're there, they couldn't run away from you. So
Yeah.
I hated that idea of treatment when the people didn't want to. So when my diagnosis kind of guided me in this Hashimoto's world, and when I started looking for solutions to treat myself, because when I went to the doctor said, "Oh, don't worry, it's treated very easy. Just take this pill for the rest of your life. You'll be fine." Of course, I was appalled by that answer. Um, not having a family history of Hashimoto's, um, none of my family members knew what Hashimoto's meant, and I was like, why did I develop this? I'm the first generation in the United States, and I'm the first one having Hashimoto's. So that was a puzzle, and I'm such a science nerd. For me, it was like, I'm gonna figure this out. So slowly, so I quit my full-time job at Vanderbilt. So that was kind of a risk to get on this journey of discovery. And that journey led me to opening up a private practice here in Franklin, Tennessee, and seeing first long distance, but like via telehealth, patients via Zoom and telehealth. And now I have so many in-person clients that I love. So now I definitely know that I'm in the right place, because I found answers for my Hashimoto's, and I live a very busy and happy and vibrant life. And I want that for everyone that come in contact with me that struggle with Hashimoto's.
I love that. I'm going to tell everybody joining a little bit about you, just a quick bio. So, you are a licensed registered dietitian, Nashville thyroid expert, and certified health and wellness coach, specializing in autoimmune thyroid disorders. And you also have expertise in digestive disorders, food sensitivities, gut health, and hormone imbalance. You're passionate about helping Clients live well with autoimmune disease, transforming their health through nutrition as the foundation of whole body treatment plans. As a dietitian and Hashimoto's warrior yourself, you've been treating people with Hashimoto's since 2015. Through your website, All Purpose Nutrition, you share your expertise in thyroid disorders and educate readers on how Hashimoto's affects gut, brain, liver, pancreas, skin, adrenals, and hormones. You live in Nashville, Tennessee, where you maintain a private practice, All Purpose Nutrition. And something super, super cool that I learned from your Instagram and we were just chatting about is that you're also a pilot.
I am. I'm a commercially rated pilot. I can fly pretty much any mid-size jet. So my brain, realized that my brain actually works in that, in mechanics. I thought I was very like language oriented, science oriented. I never thought of myself as a commercial pilot, but when I met my husband, who was a pilot, it just kind of led me to fall in love with aviation. And I'm gonna say something. I think aviation school, which took me 2 years, was harder than my medical school that I completed at Vanderbilt, because we're like, I don't know, women are not just mechanically oriented. We don't know what's under the hood of our car or the engine airplane. So like I had to pivot a little bit, but I always like every time when I was learning aviation, or I actually applied that to anything in my life. Every time I learned something hard, I'm thinking to myself, I'm preventing Alzheimer. I'm preventing Alzheimer. Like I'm just training my brain, creating new neurotransmitters, new connections. That's the only thing that keeps me going. Like not to like, oh, let me fly the plane. No, I just like, you know what? Let me exercise my brain.
Oh, I love that. What a beautiful mindset to have. And I have a 6-year-old and I try to teach him now these days when he says, this is hard. And he's like, I
Mhm.
can't do this. This is too hard, mommy. My thought process is like, you can do hard things. You can do hard
Mhm.
things. Like you can try this. You can do this. Um, I love this. I wanted to highlight that because I feel like you are just such an inspiration for what you can do with Hashimoto's. I know a lot
Mhm.
of times people have the diagnosis and they feel like very disempowered by it, where
Mhm.
it's something that prevents them from following their dreams and really living their lives to the fullest. And so I love, love, love that you were able to become a pilot. Like, how cool is that?
It's cool, it's challenging, it's stressful. You're on the road a lot, and we know everybody who's been diagnosed with Hashimoto's, you close yourself in this bubble and you're afraid of going out and exposing yourself to toxins or food that is not on your diet, all the restrictions. You can no longer enjoy things that you used to, alcohol, whatever. Even flying can flare up Hashimoto's.
Yep.
Sleepless nights, not only sleepless nights but time change, and all that stuff. So I am a prime example that if you're managing your Hashimoto's right with the correct tools, you can do anything and achieve anything in your life. So hopefully today's conversation will help listeners, or if somebody's watching this live, I really hope that we can, put our heads together and help the community as much as we can.
I love that. I'm so excited to have you on. We're going to be focusing on gut health, hair
Mhm.
loss, the right supplements, and really building that resilience. We're also going to be talking about how some people might not need to be gluten free and
Yeah.
how to hack that, right? So super, super excited. One of the first things I wanted to ask about is gut health and the
Mhm.
Hashimoto's connection. We know that every person with an autoimmune condition like Hashimoto's has something going on with
Mhm.
their gut. And you and I both love to utilize stool tests. And I feel like every practitioner maybe uses them a bit differently. So I would
Mhm.
love for you to share more about gut health and then the key markers that you look on stool tests.
Absolutely. I feel like, with Hashimoto's, we know it's not just a thyroid disease, right? It's an immune system dysfunction. And we know that about 70% of our immune system resides in our gut. That means gut health plays a foundational role in managing Hashimoto symptoms and slowing the disease progression, because Hashimoto's is not going anywhere for most of us, but we want to slow down the progression of the disease. So if your gut isn't healthy, your thyroid will not function optimally. So there are a few reasons why gut health is important. And the first reason is that your gut health is like a gatekeeper of the immune system. The gut lining acts like a barrier, preventing harmful bacteria, toxins, and undigested food particles from entering the bloodstream. And if this barrier becomes compromised, our aka our leaky gut, the immune system goes into like override, right? Increasing inflammation and potentially worsening autoimmune thyroid attack. So chronic gut inflammation can trigger or even exacerbate Hashimoto's, making symptoms very, very hard to control. The second reason why gut health is so important is that gut inflammation worsens the actual thyroid function, our gland. And inflammation in the gut increases cytokines activity. And cytokines are the proteins that kind of help transport signals from cell to cell. So when that activity is triggered, it can disrupt thyroid hormone production, conversion, and absorption. So all of that is just from cytokine from that activity. And inflammation in the gut conditions like IBS, SIBO. I know we see a lot, you and I see a lot of people with IBS, SIBO, Candida, H. pylori, gut dysbiosis. That creates like an ongoing stress response, which raises our cortisol. And we talk about cortisol and adrenals all the time. And that cortisol, a hormone that inhibits thyroid function. And finally, like I think another important reason is that gut is critical for Hashimoto's because it plays a major role in nutrient absorption. And as a registered dietitian, I concentrate majority of my time on how do we increase nutrient absorption in the gut and improve gut health. Because Hashimoto's is often linked to nutrient deficiencies, right? Even if people eat a nutrient dense diet, I always say, it's not what you eat, is what you absorb. And for example, there are some key nutrients required for thyroid health that depend on gut function. And that's our selenium. Everybody knows about selenium. Selenium can reduce thyroid inflammation and it aids in T4 to T3 conversion. Of course, our zinc, iodine, iron, our B vitamins, magnesium, vitamin D. We know that there was one of the strongest studies that came out a long time ago showed that everyone who was diagnosed with Hashimoto's had low levels of vitamin D. So you have to always think about it like first test your vitamin D and how do we bring those levels up to optimal levels. So that's the importance of the gut health. And the last thing is that your thyroid hormone, that most people don't know that about 20% of T4, which is inactive thyroid hormone, is converted into T3 in your gut. So if your gut is not healthy, you're not converting that hormone. You can be taking a mega dose of thyroid medication, but if your gut is not healthy, not converting thyroid hormone, then it's very hard to manage Hashimoto's symptoms. And those symptoms, I mean, we can write a book about just the symptoms, right? The digestive symptoms, like bloating, gas, abdominal discomfort, constipation, diarrhea, possibly in the same day, nutrient deficiency related symptoms, our fatigue, brain fog, poor focus, and man, I can relate to every symptom. And I think, signs and symptoms, there's probably like 100 of them, and they're so non-specific. That's why it's so hard to diagnose Hashimoto's, because we're all over the place and we think, oh, half of it is in our head, and it's not. So majority, like I said, majority of what I do is trying to heal our gut and support Hashimoto's through nutrient strategies like supplement support, lifestyle changes. And one of the most important nutrient strategies that I talk to my patients all the time is the diet, because we want to decrease this full body systemic inflammation. And how do you do that? By eating anti-inflammatory whole foods diet, our colorful vegetables, lean protein, healthy fats, right? We know all of that. We need to increase fermented foods, or not only, some people need to start eating fermented food, but a lot of people need to increase it. Our sauerkraut, kimchi, even coconut yogurt. If you're doing dairy free, coconut yogurt is a great way to boost the beneficial gut bacteria. Prebiotic fiber is another one. It's our flax seeds, green bananas. I know they're not tasty, but you can hide them in a smoothie. So it's okay. Our garlic, onions, and that's to feed the good bacteria, because prebiotic fiber is the food for our good bacteria. And then, of course, to heal your gut, you need to consider an elimination diet. Because we talk about, a lot of people, if you've been diagnosed with Hashimoto's, you've heard that everybody needs to follow. It's like a general recommendations that everybody needs to follow a gluten, dairy-free diet, sometimes soy-free, nut-free, nightshades-free. There is everything. It's a very restrictive world out there. But I'm here as a first personal example, and second, working with for the last 8 years, working with clients, only with clients who have Hashimoto. So I'm very specialized dietitian. I don't work with people just for weight loss or teenagers or pregnancy. I only care about my little population of Hashimoto's people. And I see a great success rate with people reintroducing gluten, dairy, soy, if they ever eliminated that.
Mhm.
And that all comes from healing your gut. That's first, right? We know we need to heal that gut lining to prevent all the irritants, maybe gluten, maybe dairy, and all that stuff going through those tight junctions into your bloodstream eventually, and causing this full body systemic inflammation. So we know we need to heal that gut. But second, it's also, and this is a big part of Hashimoto's, is that fear of, you see a few studies. There are only a handful of studies, maybe 2 or 3, that came out, said that a gluten-free diet decreased TPO antibodies. And
Mhm.
this is a very powerful statement. And a lot of people, when they go gluten-free, they're afraid to introduce the gluten back into your diet because of that one study. But we gotta be more critical and cynical about the studies that are maybe poorly done, or maybe they didn't report other things. For example, the study that reported that on the gluten-free diet decreased TPO antibody, they didn't say that they also increased foods that are high in selenium and vitamin D. And one of the best ways to lower your TPO antibodies is by taking selenium like 200 mcg per day plus
Mhm.
vitamin D, and even inositol. There's a great study with inositol. So did selenium and vitamin D lower TPO antibody, or did gluten lower TPO antibodies? So you have to take that into account. And then, that barrier to be open-minded and trying things out, it's very scary. It's very scary to introduce something back, because you remember how miserable you felt when you were following the normal diet. So
Thank you so much. That's such great insights and so much to unpack here. So first, you mentioned the fermented foods.
Mhm.
I'm a big proponent of adding fermented foods as well. This can be a really, really big game changer for people with Hashimoto's and thyroid disease. And I
Mhm.
love that you talked about nutrient deficiencies. I think this is such a powerful place to start for a lot of people,
Mhm.
so much fantastic research with selenium and myo-inositol and vitamin D in
Yes.
lowering thyroid antibodies. Um, Speaking to some of the food sensitivities, I know in the beginning of my healing journey, it's like I felt so much better gluten-free and dairy-free,
Mhm.
where people were like, "Isn't this hard for you?" And I was like, "No, it's actually really easy because I feel so bad when I'm on the foods," right?
Mhm.
Or if you had asked me 10 years ago, I would say, "I'm gonna be off of these foods
Mhm.
forever," right? And
Mhm.
my experience, about 88% of people feel better gluten-free, and about 80% of people feel better dairy-free. 80 or so percent in my experience feels soy-free. And then I was a new mom in 2018, and I started working with some like lactation consultants and taking
Mhm.
lactation supplements. And all of a sudden, like, I just had this shift in my body. I used to just find dairy very, like, disgusting. Like, it, like, just grossed me out. The smell of cheese, like, the
Mhm.
smell of milk would kinda gross me out, and this was at the same time when dairy was causing me, like, bloating, irritable bowel syndrome,
Mhm.
so on and so forth. And then within, like, a 2 to 3 day period, dairy started, like, being appealing to me again after taking,
Interesting.
alfalfa and carnitine to support, like,
Mhm.
lactation, and so interesting. I repeated my food sensitivity testing, and I was no longer dairy sensitive. Like, I had done this food sensitivity test from All Test, like, every year, just keeping up
Mhm.
with things, and every year, my dairy sensitivity was, like, sensitive to, like, everything, even butter would cause me, like, carpal tunnel and symptoms,
Mhm.
and all of a sudden, all of those things were clear, and so I became no longer dairy sensitive, and
Mhm.
I, can have dairy now. I don't like stinky cheese, I don't think I ever did, I don't think I ever will, but, I can eat cottage cheese, and I could eat a lot of different types of dairy now,
Mhm.
and I think it's something that I would love to share with more people, that sometimes, yes, you might need to go on an elimination diet. If you have celiac
Mhm.
disease, this might be like a forever elimination diet with gluten, but
It
there's
will be forever, unfortunately. There's no way around it. You don't outgrow it. You don't heal your gut by. You have to be gluten free for the rest of your life if you have celiac. But
um,
if you don't, go ahead.
oh, I was gonna say, unless we find new research, and I think you're sharing some exciting things that you're finding with your work with clients on how to get rid of food sensitivities when you don't have celiac disease, and I think that's so exciting.
Exactly. And I'm so excited, like you said, for the new research, and it needs to be researched more so we don't use our personal experience to treat, thousands of people. But it's still, I share my experience and I always tell my clients, you can take it or leave it, but we always work on mindset. Like, what are your blocks? What did you forget everything you learned 10 years ago because there's a new research, or we have proven that that research was not done properly and they lied. It was like, um, don't want to name, there is a big guy, there's a guy on Instagram. He has millions of followers, and he says there is a study that everyone with Hashimoto's are sensitive, have lactose intolerance, so we need to eliminate dairy. So the first part of his sentence is correct. Most people with Hashimoto's are lactose intolerant. The second part of his sentence, so we need to eliminate dairy. Why? Lactose is just a sugar, a milk sugar in the milk. You can still enjoy lactose free dairy products,
Yeah.
so you don't have to eliminate the whole group. So the conclusion of his statement of the research study was incorrect. And I know millions of people probably dropped dairy for that reason. You can still enjoy that lactose-free cottage cheese. That is incredible for you. All the fermented food. Now they have lactose-free milk if you're into it. Like I'm personally probably like 80% dairy free, not for
Mhm.
my thyroid. It has nothing to do with thyroid. And another thing is that there's not a really good study that says that dairy directly affects your thyroid gland. So you gotta, Think about that. So again, I'm like 80% dairy free, only for my skin. It's I have a very oily skin, and it just seems it flares up my skin if I eat a lot of dairy. But I will never say no to a key lime pie or cheesecake or something, on the menu that is full dairy. But most of it, like for my coffee, I add either oat milk or almond milk and all that stuff.
Love it.
But again, it has nothing to do with Hashimoto's, and that's what I have this conversation with my clients all the time. Like, the goal is to reintroduce all the foods back. The goal is to bring joy back into your life, especially when you don't have a medical reason to avoid gluten. If you don't have celiac or like non-gluten, non-celiac gluten sensitivity, there's no medical reason to avoid gluten. Now, if it makes you feel good, stay on it. But again, are you feeling good because when you went gluten free, you eliminated the donuts and Starbucks and all that stuff you were eating and lost weight? And yes, you eliminated a lot of inflammatory foods and additives and colors, all that stuff. So, which one is making you feel better? The just elimination of processed food or elimination of gluten? So, you have to explore that side of the world. And another, last thing I'll say about the gluten diet is that there's a very small study, there are a couple of them, with a handful of women that show that a gluten-free diet decreased TPO antibodies, right? And I said that, oh, maybe it's selenium with vitamin D. My TPO antibodies went down when I stopped gluten and dairy-free diet.
Amazing.
Amazing, yes, because when I got diagnosed, of course, I was like gluten-free, dairy-free, and I did it for a year and a half, but I was like tired. I was stressed out. I was exhausted following these rules. And then the more I looked into the research and used common sense and interpreted blogs and somebody else's conclusion, I realized that, like, okay, this is not a way to live. And so I went back to my normal eating, and I lost weight. Well, I lost like a few pounds. My TPO antibodies decreased, my inflammatory markers decreased. And I think that's because I removed the stress from constant planning, constant worrying about, or not going out with my friends because I'm afraid of what that 5 ounces of wine will do to me. I mean, I think to me it was one of the biggest shifts. And I mean, and TPO antibodies went down on a normal diet. So there's never a one fits all approach.
I love that. And I
And
and yeah, stress is such a powerful trigger
mhm,
or even reacting to foods. Whenever we're stressed, our digestive enzymes stop working properly.
mhm,
And for some people, if the restrictive diet is so stressful, then that can be a really, really big trigger. And I think,
yes.
to your point, we have to consider, I think there are people that maybe specialize in diet and they try to use diet for everything, right? But
Mhm,
when you actually look at diet as one potential intervention, then there's medications as another intervention. Then there's
mhm,
nutrient deficiencies as an intervention. Working on your stress response is another intervention. And then also looking at like your gut health. That's going to be
mhm,
another intervention. So a lot of times you might start off with a elimination diet and you're off of these
mhm,
foods, but that doesn't mean you need to be on it forever. I know I've worked with people that had autoimmune paleo diet that they have been on for years and they're
mhm,
afraid to introduce foods back in. And we're working with them. I would let's look at what's going on with your stool test, right?
mhm,
And we would find that there's like a protozoa, and that's causing so much inflammation in your digestive tract. No matter what you're eating, you're
mhm,
going to be inflamed and have a food reaction. And so I love that we're sharing about that because it's hard to get that across in like a 30-second clip on social media of what you
mhm.
need to do with Hashimoto's. It's going to be different depending on what your symptoms are, when you're diagnosed, what
Exactly.
kind of where you are in your journey, what you've already tried, what you haven't tried. And so you
Mm,
take on a really, really comprehensive approach. and I know that you're a fan of stool testing, as am I. I would
Mhm.
love for you to share more about that. You offer stool tests with your clients, and I would love to know what are some of the gut imbalances that you look out for, and how do you help them like restore that balance? Do you use just food and nutrition? Do you perhaps use some other kind of things?
So I think guts as the stool test is one of the best investments, and you literally looking inside your your gut health without troubleshooting. We test, we get results, and we have, if we know the problem, we know how to fix it. So the most common problems I see with my clients is gut dysbiosis. Of course, that's imbalance of gut bacteria that can lead to inflammation and poor nutrient absorption. So just that simplest, like this is everybody has gut dysbiosis. I don't think I've ever seen a clean stool test.
Same.
So yes, inflammation, poor nutrient absorption, then pathogenic bacteria, parasites, candida overgrowth. That's again my top priority. That's may contribute to autoimmunity. It can actually trigger Hashimoto's in some people. Of course, I always look for, well, first, every test I order, it's not optional. It comes with zonulin marker, and that's the marker of intestinal permeability, aka leaky gut. So I don't let my patients choose what they want in the stool test. Like this is because I want to see your zonulin levels. And that's shows high zonulin levels shows a compromised gut lining that can trigger immune dysfunction as well. Of course, we look at the good and bad bacteria. I look at the or I zoom in on the bacteria that make butyrate, like our Akkermansia, and we know that butyrate is like it's a key ingredient for our gut integrity and reducing inflammation. Um, of course, H. pylori probably present in like 99% of my clients.
Same.
And man, it's a nasty one. That bacteria, some people have it chronically, and they always say, oh yeah, my doctor did the stool test, but they never addressed it because it wasn't high enough, or the virulence factor, wasn't strong enough. But they don't realize what that H. pylori is doing to your gut lining over time. H. pylori, we know it's like it burrows itself, like it hides itself in your stomach lining, and it causes this full body systemic inflammation, and it triggers mast cells that release histamine. That's why so many people have histamine intolerance nowadays, because they have H. pylori that is not treated. And over the years, yes, it's going to grow into um, food sensitivities. Of course, there's actually one study that showed that H. pylori actually leads to food sensitivities, and eradicating H. pylori will clear that food sensitivity. So it's not the food that you're reacting to, is what your gut bacteria, what your cells, how they react into that food. So dairy is not inherently bad, right? Gluten is not inherently bad. It's just like, how is your body reacting to it? So looking at all of these markers, and I always come up with a care plan for each and every one of my clients. And we go into this comprehensive approach. It's diet, supplements, lifestyle, everything that's under the sun, we include in this like step-by-step guide. And that's increasing fiber in prebiotics. And I only say that as a general recommendations, because if somebody has SIBO or IBS, I will not be adding a ton of fiber or telling them to eat fermented foods, because it's only going to exacerbate their bloating and stomach aches. Uh,
Mhm.
so it's very, very personal, but overall, just in general, it's, adding probiotics. And I know I'm like all about, as a dietitian, I'm all about food needs to come first. Food is our first line of defense. But supplements make our life so much easier. And especially at the beginning of treatment, I think we need to like get a head start, because if somebody's been dealing with a problem for a long time, do we have 2 or 3 weeks to wait for, by the time you add fermented foods, it'll take a while for your body to react. But as soon as you add probiotics, a mega dose of butyrate supplements, or to improve, your stomach acid, like add digestive enzyme with HCl in it. This, you see that difference like within 12 hours, 12, 24 hours. And I know you have such a great line of supplements that are very, go to, and because you've lived through it, you know exactly what we all need, what our body requires. And um, so it's very helpful. Um, so when it comes to, again, supplements, digestive enzyme, L-glutamine is my go-to as well. I love it. It's like, yes, you can drink bone broth and stuff, but sometimes, like, I'm on the road all the time, so I unfortunately rely on supplements a little bit too much because I can bring bone broth with me, on the flight. So, I
3
do like.
ounces of bone broth with you on every, like, little baggies, right?
Oh my God, I should make a video of it. Like, I should make a funny video. Like, what Hashimoto person or a person was diagnosed with Hashimoto's, what do you do when you fly? A 12-hour flight? Like, what do you do? I should bring all my stuff with it. So I, of course, again, sun butyrate, turmeric, and omega-3. So those are my go-to supplements when addressing all those markers like red flags on a GI map stool test.
I love that. I'm a big fan of butyrate, and betaine was a big game changer. Betaine with pepsin on my healing journey. I went from being fatigued and exhausted to waking up the following morning with, like, bright-eyed and bushy-tailed. And I was like, oh my goodness, this was actually one of the reasons why I decided to write my book, because I was like, this just changing my diet was a big game changer, but then discovering nutritional supplements and digestive enzymes, it was
Mhm.
like gave me so much more of my life back. Um,
Yes. And like you said, and you wake up feeling better right away. It's just it's a good jump start. I don't think we all should be taking, 20 supplements every day, but sometimes when we create this like H. pylori protocol, if you're not getting on antibiotic therapy, if your virulence factor, H. pylori virulence factor is low enough, you can get rid of H. pylori naturally. But that protocol is pretty heavily geared towards the supplements because there's no amount of turmeric you can eat or sprinkle on your salad to dumb down the active infection. We gotta take a mega dose of that turmeric or omega-3 or whatever we're taking. So I am a big proponent of supplements, but the right supplements, right?
for the right person. I've
Mm.
been seeing a lot of emerging resistance to H. pylori. I used to
Mhm.
use like DGL and mastic gum, and these
Mhm.
were some of my go-tos for H. pylori, but a lot of people have been coming up positive despite utilizing those. Do you have any special protocols or things that you like to utilize with H. pylori? Again, it's not something that'll just go away on its own or with diet, right?
Mhm. It will never go away on its own. It will just get stronger and build resistance. So the longer you have it, I think, like I've seen client that had a H. pylori for 2 years without treating. So that's going to be a challenge to eradicate. It'll take more than 4 weeks. I think one of the best supplements that I've been using, it's called Corptis chinesis. It's a nasty, you can buy it on Amazon for like $10. It's a nasty liquid, but it has one of the main ingredients there is berberine, but it's very concentrated. So it's a natural supplement from the root. And berberine shows, the studies shows that it's one of the strongest ingredients that can eradicate H. pylori. So I always add that one, especially to my chronic H. pylori patients.
Thank you so much, like, for that. Sometimes the most disgusting things are the most effective, aren't they?
Yes, yes, I agree. But also, like, with diet, it's not just you can't pills are not a magic. Um, they're not magical. If you don't address your diet, if you don't add those flax seeds and artichokes and onions and green bananas to your diet, apple cider vinegar, digestive bitters, zinc to increase your stomach acid, nothing's going to happen. So it's a comprehensive approach, and it's so complex. Like sometimes we lose track of like, okay, what are we doing? Because there's so much going on. That's why, like my first initial consultation takes 1 hour with each client, because it's just there's so much going on. So
I love that. I think that gut health is so underappreciated, and
mhm.
I love that you really focus on that with your clients. You also focus on some additional things. What are some like really overlooked factors in lifestyle and dietary factors that you think make a huge difference?
So we everybody knows about thyroid medication. We have to take it. We have to take it, right? So that's number one. It makes the biggest influence. It keeps you alive. Of course, everybody talks about gut health, and we can spend another 3 hours talking about just gut health. But I think what people don't concentrate on is blood sugar imbalances and insulin resistance. Because most people don't realize that unstable blood sugar and insulin resistance can worsen Hashimoto symptoms, even if you don't have diabetes. And it matters because high insulin and blood sugar spikes increases inflammation and autoimmunity. It can trigger fatigue. It can trigger mood swings and brain fog. So when people think that they need to either up their medication or decrease because of increased brain fog or fatigue, one way or the other, are we not looking at blood sugar? Like, what are we doing with our, gotta check um, fasting insulin, fasting blood sugar, hemoglobin, and A1C on maybe not quarterly, but at least once a year to keep a pulse, finger on our pulse thing. So, and another thing that chronically high insulin disrupts T3 conversion,
Mhm.
leading to low energy and slow metabolism. So if you're taking, even if most people take levothyroxine, which is it's a synthetic T4 only medication, you can talk about it right for hours and days, but we all need to convert it to T3. And that conversion, of course, happens in the gut, and most of it happens in the liver. But if you have high insulin levels, that conversion will not happen. Even if you think that you're following a healthy diet and your liver is great, the conversion will not be there. You'll have low energy, slow metabolism, mood swings, brain fogs. So, the easiest way to address that is to eat protein and healthy fats with every meal to stabilize that blood sugar. We need to try to avoid high carb, especially processed, simple carbohydrates, and high sugar meals that spike insulin. We need to, of course, increase or add resistant training and walking after meals. I think that was the game changer for me, because as I feel like I live by the book. I eat right, I exercise, I'm normal weight, but my blood sugar was rising and my hemoglobin A1C, which is a marker of diabetes. This is how we see if the person is pre-diabetic or not. My numbers were climbing. I started walking after every meal. I was just taking my dog for a walk, only 10 minutes of gentle exercise, and it started dropping my blood sugar post meals, and it helped me a lot. So for me, that was like my magic bullet. I didn't change anything else because my diet was already normal. So we need to concentrate on that. And the last thing that is overlooked, I think, by most doctors and nobody really talks about is our liver and gallbladder function in thyroid hormone conversion. And I already mentioned that liver converts what's like 60% of T4 to active T3, and the gallbladder is critical for fat digestion and detoxing that excess hormone. So if these are not working well, your thyroid will not function. And nobody, like people don't even probably know where their gallbladder is or what it does. Everybody, yeah, we all like detoxing liver, but we detoxing liver with harsh supplements or protocols. So liver is our best detox organs, right? And the poor bile flow from the gallbladder, it reduces fat-soluble vitamins like our A, D, E, and K, which impact thyroid function. So again, we need to support liver. And there's a lot of talk about the cruciferous vegetables, right? In the world. So supporting your liver with cruciferous vegetables is one of the best ways. That's our broccoli, Brussels sprouts, cauliflower. We mentioned digestive bitters or ox bile supplements. That's a great one to support gallbladder function. Of course, our water, green tea, dandelion tea, whatever you want to take just to get fluids through your system to flush out toxins. And another thing that I love, and I mentioned it a couple of times during this conversation, is turmeric, which is one of the best foods to cleanse your liver because it aids in the liver it aids liver in producing bile, which helps break down fats and toxins to get it out of our system. So I think those are the two ones that we need to talk more and address more.
I love that. I think for me, I was very, very surprised. I thought I had like seasonal allergies, and then I started utilizing like gallbladder support, and my seasonal
Mhm.
allergies went away. It's just really, really incredible when you take a comprehensive plan and you really dial in your body. I know I'm a big proponent of not just when you have a thyroid condition, some people basically take like a little lens and they're like, okay, I'm just going to look at this part of your body and we're going to give you thyroid hormone. And there's like supplements that are like thyroid support supplements. But it's like it's an autoimmune condition with Hashimoto's. It's a whole body condition. And there are
Mhm.
different parts of the system that you really need to support to truly feel your best and to thrive. Um,
Yes, and it takes a village. It takes an endocrinologist. Everyone needs an endocrinologist, to get the prescription. Second set of eye. But it also everybody needs a dietitian. Everybody needs a pharmacy expert. And you're doing an incredible job addressing it from all sides. It's a complex issue. I mean, we're talking about an autoimmune disease. I don't even understand how people without any medical background or any research background can treat. It's an autoimmune disease. It's so complex. Like I said, like I don't understand all parts of it. I rely heavily on research and do my best to bring the best research out in the light and present it in 30-second video on Instagram. But it's so hard.
I agree with you. One of the things that's a super, super frustrating symptom for a lot of people is hair loss. I
Mhm.
know this is one of your areas that you love to focus on. Can you tell us a little bit more about the causes that you see and what you like to utilize?
Absolutely. So hair loss, it's personal. It's frustrating, it's emotionally draining symptom of Hashimoto's. When I was diagnosed, actually the reason I diagnosed myself with Hashimoto's, I found that something was wrong with me because doctors could not. But since I was already working at Vanderbilt, I got my own blood work done and I pretty much found my own Hashimoto's. But the reason I went to get blood work done is because my hair, I was pulling clots of hair out. I was sitting, after shower, I was crying in the bathroom because it felt like I lost at least 50% of my hair, which recovered most of it. I think I have it like 80% of it back. But before it was so full and lush, and it has nothing to do with age. It's only 10 years apart. Like it should not have. Hashimoto's hair loss is very distinct. So I know exactly where people are coming from when they're come to me or just, searching for quick fixes for hair loss because this is our security blanket, especially for us, the girls, right? Everybody
Yes.
wants shiny hair and stuff. So I actually had a whole podcast for 2 years with Kimberly Vaughn. She owns two hair loss clinics here in Nashville. We have like 100 episodes on connection between Hashimoto's and hair loss. That's how complex and complicated that topic is. But I'm gonna try to like give highlights what I see in my clients. The problems that arise, it's that low T3 levels. It doesn't matter how what your diet is, how well you're eating, how well you're managing your stress. If you have if your active thyroid hormone T3 is low, you so basically what T3 does, it stimulates hair follicles to grow. So if that hormone is low, your hair will not grow. Maybe you'll stop shedding from all other stuff that you're doing to it, but it will not grow. And there are ways to improve your T3 conversion. Is we talked about gut. That's the conversion side, your liver. And third way, it's more pharmacy related, pharmacology, is taking a T3 only medication or taking like a natural desiccated thyroid that has T3 hormone in it. So again, there's like, many ways to improve it. The second reason for hair loss is, of course, nutrient deficiencies: iron, zinc, selenium, B12, biotin. All of them play a huge role in how fast your hair grows, how fast it's falling out, how is it brittle, is it shiny. Every doctor tests for iron. Nobody tests for ferritin. You can have low ferritin levels, which is a storage form of iron, but normal iron levels. And when I told that to my doctor, he said he's never heard that before. But then he looked at my blood work, and I'm always anemic. And this is the problem with people with Hashimoto's, and especially menstruating women. We lose a lot of iron, and we don't absorb iron well. We don't eat enough red meat and all that stuff, to get iron. So, but low ferritin is one of the main reasons for hair loss. And research shows that anything above 70 nanogram per milliliters of ferritin, that's basically people who have ferritin levels above 70 don't have hair loss. And that was a great study. So for me, it's like if somebody coming to me with hair loss with ferritin levels at 35, I'm like, we're going to bring you up to 70 and then we'll see. So I like to have a number to reach for. And that's why we have optimal thyroid levels, right? Because it's something we need a goal to strive for. So of course, right, like I said, nutrient deficiencies, chronic gut infections. Not only leaky gut, low stomach acid. Low stomach acid causes poor nutrient absorption. Our SIBO, small intestinal bacterial overgrowth, it impairs digestion and absorption. So all that stuff like chronic gut infections are nasty by itself, but they also prevent nutrient absorption. So that's another reason to get a stool test done, to treat these red flags, to improve your hair loss. See how like we got to hair loss through stool tests? Like what? That's how complicated it is. You have to be a detective to figure all this stuff out. I don't even need to talk about high cortisol, right? How hair loss or stress level, high stress level causes hair loss, because chronic stress raises cortisol, and cortisol slows the hair growth and increases shedding. Full body systemic inflammation, all that stuff. And finally, our female sex hormones, estrogen, testosterone, DHT, always check. You can't just know what they are. You gotta, do yourself a favor. Like what I started doing once a year, I gift myself a comprehensive blood work. Like January 1st, I just go on that, on the website. You don't have to have an MD for it. And I know, Dr. Wentz, you have a patient-oriented blood work that you can order yourself online.
Yep.
Do
People can
yourself.
order.
Yes. Just get all the blood work done, comprehensive. Test all the hormones. Test T3, free T3. Test reverse T3, your TPO antibodies. Do it for yourself, like a gift. And that's why I started doing it 8 years ago when I was diagnosed, and I think it's the best thing you can do for your health, and in turn improve hair health. And if somebody wants to listen, I have hair related podcast episode, like I said, like 60 still posted on my page. If somebody wants to dive in and listen to it, there's so much information.
Amazing. I'm going to have to link that for the show notes because I know everybody is excited to listen to those and dive deep into hair loss. I know for me as like a Leo, I could deal with all the symptoms I was having, but the hair loss was just like, this is something that I really, really need to handle. And I love your perspective about gifting yourself these things.
Mhm.
Just like what a gift it is to have amazing health and amazing hair too, right? And I feel like we really
Yes.
need to think of ourselves as an investment, and that way that you can really, really thrive versus, I guess, for me, when I was first diagnosed, it was more about asking for somebody to like heal me and do these things for me. And now it's more of I'm empowered and I can reach out for help and I could reach out for assistance. And I don't just rely on like this doctor says no and closes the door in my face. Like I'm going to look for other people to help me get the labs that I need or the treatments that I feel like I need to advocate for. So really, really appreciate that perspective. I have really, really loved having you on, and I feel like we need to come back, have another episode where we deep dive into another topic with you. Um, I know a lot of people have some questions that are coming up. One of the questions I would love to ask for you is how do you add in gluten back into your diet? Like, do you have any best practices for that? And what about it increasing antibodies? Can you share a little bit more about that? Maybe some of the research on antibodies?
Absolutely. So as far as research, like I said, there's like only 2 studies that show that a gluten-free diet decreases TPO antibodies, but it didn't decrease in everyone. So there is one caveat. Which side are you falling on? So unless you do an elimination diet for at least 4 weeks, because half-life, or not half-life of gluten, but gluten stays in your system up to 4 weeks. So you have to be completely gluten-free for more than 4 weeks, and then start introducing gluten slowly. Don't eat a bowl of pasta right away and say, oh, I had a reaction. I actually had a client who said, I had a reaction to a bowl of pasta with carbonara sauce or something. It was like a dairy related sauce. Sorry, I don't eat like sauces, so I can't remember what it was. But I asked her, did you react to the sauce that was dairy? Because she was lactose intolerant. Or did you react to gluten? And when she ate just pasta, just with olive oil and red pepper and stuff, she had zero reaction. So what are you introducing? It's first, start slow with introducing gluten. Second, don't add, it has to be like clean gluten, just pasta,
Yeah.
no sauce. And well, I think those are 2 main things of introducing. And, I always say, whatever you want to hear, you'll find. So if you Google it, how bad is gluten or negative effect of gluten on thyroid or Hashimoto's, you will find thousands of articles. But if you reframe your question and you ask it differently, just be open-minded. And that can apply to anything in your life. Ask your question differently. What are the benefits of eating whole grains, your gluten, for overall health, including thyroid? And you will find thousands of articles about that. So change your perspective, um, just get out of your box and everything you've been learning and try it out. I'll never tell you like, nope, gluten is okay for you. You're gonna have to figure it out for yourself. But I guide my clients through it. We do an elimination diet and we do a tactical, step by step, bringing it back one thing at a time.
Yeah, I think that makes so much sense. I know a lot of times people just do an elimination diet and they perhaps don't add things in at the right pace. I know
Mhm.
personally, I was like, oh, I've been off of gluten, dairy, soy, and tomatoes. And then my first food I introduced was pizza. And then of course, I felt terrible. It was like a huge deep dish Chicago style pizza. And
Yeah.
then you're like, okay, well, what is it again? And then you kind of have that fear of introducing. So doing that introduction slowly and one food at a time and figuring that out. And
Mhm.
perhaps, really working on all of the other things that we talked about, really going deep into
Exactly.
the gut health.
Always, like, whoever's watching and listening, for your own sake, test your TPO antibodies. Get the blood. You can just test TPO antibodies. Test it. Start getting gluten back into your diet and see. Maybe you, just like me, maybe your TPO antibodies will go down. It will give you a great reassurance that maybe gluten is okay for you. Like, I don't have a celiac markers, I don't have non-celiac gluten sensitivity. Like I mentioned, my TPO antibodies went down after I went back on normal diet. So maybe you're just like me. We're all, in this spectrum. So don't be afraid to test it out.
I love that. I love that empowering take. You also have a free guide for us. Can you tell us a little bit more about that and where people can get that? I'll link it in the show notes.
Yes, I do have a free guide. And now, so this free guide, I created it discussing 5 stages of Hashimoto's and how to address it from, like, medical nutrition therapy perspective, because I'm a clinical registered dietitian. So my guide is geared towards nutrition, supplements, lifestyle approaches. And I created that guide because so many of my clients and followers are all at different stages. Somebody was just diagnosed and messaging me like, "What is Hashimoto's?" It's like, and somebody's already been dealing with it for 10 years and can teach me something, because we all know our body well. So I created this guide to kind of give you a jump start, a head start. Like, here's, if you just diagnose, here's what to do: 1, 2, 3, 4, 5. And it, again, a nutrition, supplements, lifestyle. Very minimal, very generalized. Again, please don't take that guide as a medical advice, but it's there for you. It will be, Dr. Wentz, you said you'll link it in the show notes. But if somebody wants to go on my Instagram and just comment 5 stages, just 2 words, 5 stages, under any of my posts, it will automatically send you that guide.
That's
So,
perfect. Thank you so much for sharing that with us. And where can people learn more about your work?
oh man, I hate to say that, but I think Instagram is my best business card at this point, because it's very accessible. It's, you can see everything I do. You can see where I stand on nutrition research and all that stuff. Um, So Instagram, I think, is one of the fun ways to find me. Of course, I have a website where I list the services I provide, prices, payment plans. Everything is laid out there clearly. So you can book on my website. You can book a free discovery call. I offer a 15-minute call because I never want to force anybody into this relationship. Like, I want to make sure we connect. I want to make sure I'm the right person for you, because if I'm not the right person for you, I refer people to other dietitians that either concentrate on other stuff or another doctor. I have a huge referral network at this point. I've been doing it for 8 years. So I want to make sure we're a right fit for each other, and we have this connection, because I think it's very personalized. So Instagram, website, allpurposenutrition.com. So yeah.
Thank you. Thank you so much, Natalia, for being here. This has been such an incredible conversation. It's been so much fun connecting with you. And I hope everybody listening, I hope this has been healing on your healing journey. Until next time.
And Dr. Wentz, thank you so much for having me. I hope this was helpful, and we have so much more to cover. So I can't wait for next episodes.
Yes, let's do a part 2. Thank you so much.
Yes. Thank you. Bye,
Bye, everybody.
everybody.